Welcome to my presentation for EDU5IHP. In here, I'll be discussing the three dimensions of health literacy and also how the five propositions of health and physical education from Australian curriculum can be implemented and integrated to provide the quality HPE programs within the primary schools. According to Australian Institute of Health and Welfare, all in all, Australia is a healthy nation. However, there are serious areas of concern in relation to children and young people's health that need to be tackled. Some of these areas are chronic diseases, sedentary lifestyles, alcohol use, obesity, diabetes, and many other mental disorders. It is regarded that early intervention and prevention is crucial. To educate the young generation regarding their today and tomorrow in regards to their health can be best started at schools. The National Health and Hospitals Reform Commission and National Preventive Health Task Force has recommended that one way to strengthen consumer engagement within a health system is to ensure health literacy comprise a core element of the national curriculum for primary and secondary schooling. World Health Organization defines health literacy as the cognitive and social skills which determine the motivation and ability of individuals to gain access to, understand and use information in ways which promote and maintain good health. It is therefore more than being able to read pamphlets and make appointments. The Australian Commission on Safety and Quality in Healthcare defines it as the knowledge, motivation, and competencies of an individual to access, understand, appraise, and apply health information to make effective decisions about health and take appropriate action. In the year 2000, Nutbeam proposed the health literacy model, which was chosen to inform the approach to health literacy in the national curriculum. His model includes three dimensions, which are functional, interactive, and critical health literacy. Functional health literacy is basically the ability to function in everyday situations using basic skills in reading and writing. It is the transmission of factual information on health risks and health services utilization. Students achieve an increased participation in population health programs. The goal of interactive health literacy is development of personal skills. It relies on the solid foundation of functional health literacy and gives opportunities to develop skills like problem solving, food preparation, hygiene, and communication in a supportive environment. Students develop improved capacity to interact with social norms and groups. Critical health literacy gives the learning opportunities which address the social inequities, determinants of health, policy development, and ways of affecting change. It builds the capacity to participate in societal actions to bring about health improvement for disadvantaged groups. We can take an example of one of the focus areas from Victorian curriculum, health and physical education, which is mental health and well-being. Many schools have incorporated the programs like the Resilient Project, Smiling Mind, Bounce Back, Mind Matters, and many more, which help young Australians to strengthen their self-esteem, optimistic thinking, and to maintain mental health well-being, positive psychology, and mindfulness. The Australian curriculum for health and PE has been shaped by five interrelated propositions through which the students can learn the skills of how to be resilient, build and manage their relationships, make decisions, and take action to promote their health, safety, and physical activity. We can see many posters in our surroundings like eat healthy foods, don't smoke, etc. But these messages are often ignored by almost everyone. So it is very important to teach these messages practically in the schools so that the children can learn through them. Strength-based approach supports the students to identify their strengths on which they can make healthy, safe, and active choices. Movement is central to health and PE. It is not learning in the movement, but it is actually learning about the movement and learning through the movement. Health literacy, as discussed earlier, is a very important element in HPE. Australian and international research into future of health outlines the importance of health literacy as an investment through schooling in health promotion. Let's take a simple example. If we want to be good at the rocket science, we can't just go and build the rocket. We actually need to learn maths, physics, and engineering and use those skills to build it. Similarly, to be physically active and healthy, we need the basic fundamental skills to develop the ability to make healthy choices like eating well, making decisions about our emotional well-being, and so on. Through the critical inquiry approach, students can develop the skills and dispositions of lifelong problem solvers, critically appraising information and making informed decisions. According to the National Health Survey, the rate for the obese children between 5 to 17 years of age increased from 5.2% in 1995 to 7.5% in 2008. Studies have shown that once children become obese, they are more likely to stay obese into adulthood and can develop the different types of chronic diseases. There could be many factors leading to the unhealthy eating habits like increase in the consumption of processed food, sedentary lifestyles, digital devices, etc. Schools play an important role in shaping the lives of the individuals. According to the research, about 70% of the teachers had not participated in professional development health-based PE programs in the last 3 years. They should refine their skills regularly in order to provide the best health-based learning environment for the students. The schools should embrace the health and physical education as a whole school approach and teach it as a one subject rather than two. They should integrate the modern pedagogies of teaching health and PE rather than just the traditional PE. There should be mini breaks during the lessons just to keep the bodies moving, and the recess time should be encouraged as an outdoor playtime. The schools can organize incursions, extra activities after school based on healthy eating. The teachers can plan the lessons based on the benefits of outdoor activities, healthy eating, safety and well-being, managing relationships, and the fundamental movement skills which the students can apply on themselves and promote in the community. The schools can also work in the partnership with the other schools to share ideas, experiences, and resources. Studies have found out that it is difficult for the generalist classroom teachers to focus on health-based PE when they are responsible for all the learning areas. Hence, having a specialist HPE teacher within the primary school can deliver the quality and specific health-based PE lessons. Parents should be encouraged to participate in the ongoing programs regarding healthy eating and practice them at home as well. The schools can develop their own fruit and vegetable gardens where the students can be taught how to grow, harvest, prepare, share the fresh and nutritious food. For example, Stephanie Alexander Kitchen Garden National Program assists with the establishment of kitchen and garden infrastructure and support healthy lifestyles. Policies can be implemented for the canteen and the vending machines to only provide the healthy alternatives of food and drinks. So, implementing the health based PE policies and programs will make a powerful contribution towards a healthy future for students, and they will have the opportunity to attain their maximum educational potential and pursue a lifetime of good health.